All right, so diving in again today.
Yeah.
And today's deep dive, well, it's a big one. It's RFK Jr.
Oh, yeah. This is going to be interesting.
Yeah, it is. It's his appointment as the new Secretary of Health and Human Services.
Hmm.
And of course, this has caused a lot of waves.
Big waves.
Big waves,
Yeah.
especially, surrounding his views on vaccines and public health. And, we've got a big stack of articles here.
Big stack.
Yeah, there's a Vanity Fair piece that really explores, what kind of influence RFK Jr. might have.
Right.
There's, accounts from AP News about people who have been affected by his work, his anti-vaccine work. We even have a Wikipedia entry about the Samoa measles outbreak.
Oh, wow.
That's gonna be a big one. So yeah, a lot to cover today.
Yeah, and what's especially, I think, important to remember here is that we're not just talking about, like, theoretical concerns.
Right.
RFK Jr.'s history kind of shows that his actions have had a real impact and in some cases, really tragic consequences.
Yeah, and that's, I think, what a lot of people are really worried about.
Yeah.
Right. It's not just like theoretical. It's like,
Mhm.
no, this has happened.
Right.
And like the 2019 Samoa measles outbreak,
Uh-huh.
it's just a chilling example of how quickly things can go wrong when misinformation really takes root.
Yeah, and that outbreak wasn't just, a statistic. It
Mhm.
was a horrible event, really. 83 people died in this relatively small population of 200,000. And what makes it even more tragic is that a lot of the people that died were infants.
Oh wow, infants.
Yeah.
That's really hard to hear. It's hard to even imagine what those families must have gone through.
Yeah.
Can you tell us a little bit more about what happened?
So the Wikipedia article, it paints a pretty grim picture. The measles outbreak was linked to this big drop, this steep decline in vaccination rates. So in just a year, the rate went from 74% in 2017 to just 31 to 34% in 2018. And so this really created kind of a perfect storm for the virus to spread, especially, among those who were too young to even be vaccinated.
And this drop in vaccination rates, was it linked to anything specific?
So this is where things get really, really complicated, right? Just a few months before the outbreak, before it really blew up, RFK Jr. visited Samoa, and he met with, local anti-vaccine activists. And so, with his visit, along with, his kind of platform and his influence, this kind of fueled vaccine hesitancy,
Yeah.
Among the population.
So even though he may not have like explicitly said don't get vaccinated, just his presence there, his whole stance on vaccines probably contributed to the environment that allowed this outbreak to happen.
Right. It's kind of like, when you have a figure who has a platform, they really have to think about, what they say and what they do, because there could be real consequences.
Yeah.
And this is where the AP News article comes in, because they have a quote from a Samoan nurse who was there, who was working during the outbreak.
Yeah.
And she talks about how there was all this fear, all this confusion that just gripped the community.
Right.
And that, RFK Jr.'s visit, kind of emboldened this anti-vaccine sentiment. And it's really a tragic reminder that public health isn't just about numbers.
Right.
It's about real people,
Yeah.
real lives. And there are real consequences to spreading misinformation.
Well, RFK Jr. denies any responsibility for this.
Yeah. He says that he never actually told people not to get vaccinated.
Right.
But, he's got this whole history of being skeptical about vaccines.
Right.
Like the whole thing, about vaccines and autism, which has been debunked. So,
Yeah.
it raises some serious concerns about what his words are doing.
Yeah. I mean, this is a classic example of how misinformation, even if it's disguised as just asking questions or let's have an open discussion, can have some really dangerous consequences,
Sure.
especially when it's coming from someone with a big platform.
Absolutely. And it's not always about, rejecting science outright. It's about creating doubt.
Right.
Making people not trust things, and that undermines public health efforts. So where do we go from here? What does this appointment mean for the future of public health in America?
That's the big question, isn't it?
Yeah.
And it's one that we'll keep exploring as we continue this deep dive.
Right.
But I think one thing's really clear. We have to understand what RFK Jr. has done in the past, like with this Samoa measles outbreak,
Mm-hmm.
to even begin to grasp what kind of challenges and risks his appointment brings.
Yeah.
Pretty sobering thought. But before we get into all that, I think we should take a closer look at RFK Jr.'s, overall stance on vaccines.
Yeah.
and, what his plans are for the Department of Health and Human Services.
Okay, let's dive into that. There's a lot there to unpack, and
Mhm.
I think it's super important that we really try to understand, what his vision for American health care really means. It's not just vaccines, though, right?
Right.
I mean, RFK Jr.'s kind of got this pattern, I guess you could say, of being skeptical about like all sorts of medical stuff.
Yeah, that's what really worries people. It's not like he's just focused on this one thing. It's like this broader distrust
Yeah.
of, doctors and scientists.
Right, exactly. Like he's got this book.
Oh, yeah, I heard about this.
Yeah, and it claims that there's this huge increase in sudden deaths in young people
Right.
because of the COVID-19 vaccines. And he even like uses the story of this 12-year-old kid, Braden Fahey,
Yeah.
includes his photo and everything, making it seem like he died from the vaccine
Yeah.
when, tragically he died from a malformed blood vessel in his brain.
Jeez. It's just like using a kid's photo like that and without the family's permission too, right? Just to
Yeah.
push this agenda. I don't know, it feels really wrong. Exploiting a tragedy like that.
It's really, I don't know. I mean, it definitely raises some ethical questions. How far is too far, right? Just to spread this kind of misinformation. And the thing is, like, this book, it's called Cause Unknown.
Doesn't know.
Right. And it's full of this misleading stuff,
Right.
cherry-picked data. It's all designed to, fit this narrative
Yeah.
instead of actually looking at the science.
So it's not just, him saying, "Hey, I've got some concerns." It's like he's actively trying to spread misinformation.
Yeah.
That could actually hurt people.
Exactly. And it doesn't stop there.
Right.
I mean, he's made these unsubstantiated claims about antidepressants too, like linking them to school shootings.
Mhm.
And I don't know, that kind of talk is just, it's not only wrong, it's incredibly irresponsible.
Yeah, especially considering how important mental health is
Right.
and how, people need access to treatment that works and is safe. It feels like, with RFK Jr., he's not really looking at the whole picture.
Yeah.
He's just picking and choosing the bits and pieces that fit what he already believes.
Yeah, you're exactly right. He's not really engaging with the science in a honest way. And that's what's got a lot of experts real worried
Right.
about what'll happen if he's in charge of the Department of Health and Human Services.
Yeah. It's not even just about, specific drugs or treatments anymore. It's about, like, do people even trust the institutions that are supposed to be keeping them safe?
Yeah, that's a huge point.
The CDC, the FDA, the NIH. If people don't trust them, where do they go?
Exactly.
Who do they believe?
Right. It's scary to think about, especially nowadays when, misinformation is everywhere. If people can't tell what's real and what's not, when it comes to their health.
It's a recipe for disaster.
It is. And that's where this Make America Healthy Again thing comes in. It's kind of RFK Jr.'s big plan, I guess you could say, for changing American healthcare.
Yeah.
And a lot of people are really concerned about it.
The Make America Healthy Again movement.
Yeah, or MAHA for short.
Yeah. MHA. Okay. I've heard, a little bit about it, but what does it really mean? What are people so worried about?
Well, so the Vanity Fair article really gets into it.
Ah.
And let me tell you, it's pretty radical.
Okay.
I mean, RFK Jr. talks about like controlling these public health agencies.
Right.
The CDC, the FDA, the NIH.
Like controlling them. What does that even mean?
I don't know. It's not really clear. But he also wants to like completely change how the FDA approves drugs. He wants to like make it more like the nutraceutical industry.
Nutraceuticals. What are those?
Like vitamins and supplements and stuff.
Oh, okay.
Which are a lot less regulated than pharmaceuticals, and that's what's got a lot of people worried. Could you imagine
Yeah.
the market just flooded with all these products that haven't been properly tested?
Yeah, that sounds kind of dangerous. And it's not just RFK Jr. behind all this, is it?
No, not at all. There are other people involved too who have, some pretty controversial views as well, like Dr. Jay Bhattacharya.
Oh, I've heard that name.
Yeah, and Joseph Ladapo.
Okay.
And they're both known for, their stances on COVID vaccines and other public health measures.
So basically what we're looking at is a situation where, like, personal beliefs could end up being more important than actual science when it comes to making public health decisions.
Yeah, I mean, that's the fear. And it's a fear that a lot of scientists and doctors share. They're worried that all the progress we've made in public health over the years could be like undone.
Right.
And we could see all these diseases come back that we thought we had, gotten rid of. Measles, pertussis, polio even. It's pretty scary.
Yeah, definitely. And we have to remember, all this isn't happening in a vacuum. There's already this feeling out there that the government and these institutions can't be trusted.
Right.
And it's gotten worse since COVID.
Absolutely. It's a really complicated issue with a long history. But the consequences, they're very real. That's why it's so important to understand what this movement is all about and what it could mean for all of us.
Okay, so we've got, RFK Jr. and his history of being skeptical about vaccines.
Right.
And his plans for the Department of Health and Human Services that could, potentially be dangerous.
Yeah.
And then this whole MHA movement.
Right.
That wants to change American healthcare in a really radical way.
Yeah.
It's a lot. And I've got to say, it's pretty unsettling.
It is. It's a lot to take in, but it's not all bad news. I mean, there are still people out there who are fighting back against all this misinformation.
Okay, good.
Experts and organizations that, believe in science and want to protect public health.
Okay, so that's good to hear. That's good to hear. So, we've talked about RFK Jr., we've talked about this MAHA movement, but, it can't just be him and his supporters.
Right. Oh, no, definitely not. I mean, there's a lot of pushback, especially from the scientific and medical communities. But, they're not alone. A lot of people are pretty worried about all this.
Yeah, I bet. So what's that pushback look like? I mean, what are people saying?
Well, a lot of experts are speaking out.
Okay.
Like there's this great AP News article that quotes a bunch of them, and they highlight all the dangers of RFK Jr.'s approach. Like Dr. Joshua Sharfstein,
Right.
he used to work for the FDA, and he points out that if you weaken the rules for approving new drugs,
Right.
it could be really risky.
Yeah.
We need to make sure that those drugs are both safe and effective.
Yeah. I mean, deregulating drug approvals like RFK Jr. wants to do, it does sound kind of scary.
It is. And it's not just about, people getting hurt physically.
Right.
There's this other doctor, Dr. Vin Gupta. He's a critical care pulmonologist. And he's worried about what all this will do to the relationship between, patients and their doctors.
Oh, okay.
He's saying that RFK Jr.'s rhetoric
Right.
could make people suspicious of their doctors, not trust them. And if that happens, it's going to be a lot harder for doctors to do their jobs.
Right. Yeah. I mean, it goes back to what we were saying before about trust. If people don't trust, scientific institutions or medical institutions,
it's a problem.
Yeah.
A big problem. And it's not just, individual doctors who are speaking out. Organizations are too, like the Robert Wood Johnson Foundation.
Okay, yeah.
They do a lot of work in public health, and they're pretty concerned too. The CEO, Richard Besser, he sums it up really well. He gets it.
What do you mean?
He understands why people are frustrated with the healthcare system. I mean, things aren't perfect.
Right.
But he says even if we want change,
Right.
we got to be smart about it. We have to make sure that those changes are based on evidence and that they're not going to, hurt people, that they're actually going to make things better for everyone.
So it's not about saying no to any change at all. It's about making sure that those changes are the right ones.
Exactly. And I think what's really important to remember here is that this isn't about politics.
Right.
It's about, people's lives.
Yeah. So I mean, all this is pretty overwhelming. You've got these powerful people pushing these ideas that could be really harmful.
Right.
What can we even do?
Well, that's the question, isn't it?
Yeah.
I think, first of all, we have to educate ourselves. We can't just believe everything we hear.
Okay.
We need to learn how to think critically, to check our sources, and to really understand the science behind, all these public health recommendations.
So it's about being smarter about what we read and who we listen to.
Exactly. Don't just take things at face value. Ask questions, look for other sources, and see what the real experts are saying.
So it's about becoming our own, health advocates.
Yeah.
Doing our own research, making informed decisions for ourselves and our families.
Exactly. And I think it's also important to talk to each other, even when it's hard. We need to have these conversations to challenge misinformation, but to do it in a way that's respectful and uses evidence.
So, having those tough conversations with family and friends, sharing, accurate information.
Yeah.
And speaking up for policies that are based on science.
Yeah, exactly. And don't forget, we all have a voice.
Right?
We can contact our elected officials. We can support organizations that are fighting for public health.
Yeah.
We can make a difference.
This has been a lot.
It has.
It's been a lot to take in, but it's been really helpful.
I'm glad.
We've learned about RFK Jr. and his appointment and all the concerns that it raises. But we've also learned that there are people fighting back.
Right.
And that we can do something too.
Absolutely. We face some real challenges, but we're not powerless.
Yeah.
If we stay informed, if we, use critical thinking, if we stand up for what we believe in,
Yeah.
we can get through this and we can make sure that public health is protected.
It's a call to action.
It is.
We can't just, sit back and watch all this happen. We have to do something for ourselves, for our communities, for the future.
Yeah.
We have to stand up for science, for reason, for the health and well-being of everyone.
Absolutely. Couldn't have said it better myself. Let's all do our part, to make sure that public health is a priority.
Yeah. Thank you so much for guiding us through all this. It's been tough, but I feel like I've learned a lot.
That's great to hear. And remember, knowledge is power. So the more we know, the more we can do to make a difference.
Absolutely. Until next time, keep diving deep, everybody.
Yeah.